I hope that most of you will continue to perform maternity care. Visits prior to the first prenatal and unrelated presenting complaints, you can use a regular visit and counseling fee. But once you've had that first prenatal periodic health exam, then you can bill $14090, which actually pays a little bit more than a full complete exam. You can also do this if a patient transfers to a new physician. So if you do refer to another doctor, they can bill this as well. After you've billed the 14090 for visits afterwards, instead of billing the 0100, you can bill a 14091, and that allows you automatically with most EMRs to bill for the urine dip that you're going to do to look for proteinuria. In terms of maternity care, if there are any psychological issues or emotional issues, you can also bill the 120. But again, as soon as I tell you anything that ends in 20, there should be a reflex that goes off saying you must document that it is at least 20 minutes in length. And if you do have a prenatal patient who has HIV, you can also bill the 13015 HIV management fee. In terms of the postpartum visit, you can bill 14094, and that's no matter what kind of delivery they had. For the newborn care, remember we said that up until the age of 2, all kids, their regular visits are 12100. Most EMRs have something that's like the Roark. You may have specific templates that you use, and those are always good. And normally people will see the child at 1 week, 2 weeks, 1 month, and then at 2, 4, 6 months, 9, 12, 15, 18 months. So as long as you have that information there, whether it is the Roark you use or something else that is in your EMR or something that you've created, just make sure that you do have everything down, partly for the audit and mostly because it's just darn good care. Group medical visits. What a lot of people don't understand is that the group medical visits can be quite good as well. It is extra work to organize them, but for example, if you have a large diabetic population or many patients with conditions such as hypertension or asthma, where you find that you're often giving very similar advice or that people would benefit from learning from each other, then you can certainly bill this group medical visit as well. Make sure, of course, that you do chart on each and every patient, although again, you may want to use a template in your electronic medical record. So as you can see, if you only have 3 patients, for each half hour, you would get almost $75 for it. And if you went up to 10 patients, you would get almost $115 for it. We're coming towards the end, so I do want to remind you that this has been a lot of information. I'd like to congratulate you for getting through it. And what I'd like to remind you is that you are not alone. You have many resources. On the one hand, try not to rely on your colleagues, because they may not be up to date, and some of the practices that they've had, even if they have been doing them for a while and being paid for them, may not be correct. And I've certainly heard some very sad cases of people who have been billing according to what their colleagues suggested, then their colleague gets audited and has to give back hundreds of thousands of dollars, and then they get audited as well and have to do the same. We have plenty of resources from the Society of General Practitioners, General Practitioner Services Committee, to Doctors of BC, to the Medical Services Plan Fee Guide, the Uninsured Services Guidelines that we talked about, and a couple of emails that I've listed here as well. So if in doubt, please do make good use of these resources so that when you bill for something, you can bill confidently. And I would be remiss if I didn't say, for those of you who are primary care doctors, which should be everyone who's listening, please join the Society of General Practitioners. It is your organization that is going to look out specifically for primary care doctors and advocate on their behalf for their fees. And they have a wonderful website that we have to give a big shout out to Tracy Monk, to Dr. Tracy Monk, for setting up and maintaining. And this is an excellent, excellent guide that is available to you. Please join the Society of General Practitioners when you pay your Doctors of British Columbia dues. And by joining the SGP, your money will go towards advocating for you, as well as giving you access to this tremendous tool from the wonderful Society of General Practitioners website. A couple of take-home messages. Remember, treat your billing like you would any other continuing medical education. Things change and you need to be up to date. Read the bulletins and the fact sheets that come out to you. If there's seminars, please go to them. Although I know we often complain about money, as with anything, we have to be professional. We have to practice with integrity. If you've done the work, bill for it. Most people don't. But don't do work just because you can bill for it, or because it's been a slower day and you're going to do a couple of extra biopsies of seborrheic keratoses that you think are trying to convince yourself look a little bit suspicious. Please don't have people come back monthly for birth control or come back monthly for antihypertensive medication for blood pressure that's well controlled. Think about the good customer service that you're doing. If you're in primary care and you're doing real primary care, you will be plenty busy, and your patients will be thankful to come to see you for value-added care and not for unnecessary care. Remember, you do deserve to be paid for what you've done, and the income that you have affects everything, such as your effort, your hours, your lifestyle, and your professional satisfaction. So thank you very much. Feel free to email me any questions that you have as well. Feel free to follow me on Twitter. Take care.